My name is Gabe Tylov. I'm the Associate Director of Adult Education and Community Outreach here at Phipps. I met many of you last night. Very honored and excited to be moderating our final panel discussion today, which is titled Future Food Trends That Embrace One Health Solutions. Our speakers in this session will help us vision the future of our food systems and also discuss the strategies, considerations, and approaches that can bring these visions into a reality. First up, we have Dr. Bonnie Bunton, a One Health consultant at the University of Arizona. Please welcome Dr. Bunton.
Wow. First of all, thank you for coming back for the last session. We're bringing in the cows now. I'm very pleased. And Sarah, I want to thank you for helping to get me here and for all the assistance I've had. Can you all hear me okay? Because I don't want to yell at you, but anyway, I'm very pleased. Today I want to take you on a bit of a journey. I had a wonderful opportunity when I was recruited to go to the University of Calgary in Alberta, Canada, to start a new veterinary school that was co-located in the same building as the medical school. And so with me, I brought the vision of implementing One Health in the veterinary school. And the tool that was most useful for me is that I was a joint professor in the medical school in the Department of Community Health Sciences. This is where the anthropologists, sociologists, psychologists resided. And they are very adept in working with communities. And it was a great partnership between the medical school and the veterinary school in an opportunity to start looking at how do we actually do One Health. So what I'm talking about today is how do we do One Health? And I'll have just a brief introduction about the food journey that we're going through. You've all heard about the complexities of food systems and the challenges for sustainable food systems. I'm going to do a little bit more on that. And that this requires and is in great need of for the One Health approaches, and I'll define what a One Health approach is. Why do we need to develop One Health transdisciplinary practitioners? You've heard about collaboration. I'm going to go into a little bit more about that. How do we create the future leaders for One Health? And the barriers to implementing One Health in the academic and the other institutions that we work in. And then what are some tools that we found out at the University of Calgary that we can use to promote the implementation of the One Health transdisciplinary approach? So we always have to ask, why is this so urgent? There seems to be a convergence of many different factors happening in the world that are impacting animal, as you heard about the ecosystems, the services, the plants, the provisioning that we rely on, and also human health. But today I'd like to say that it's also leading to unsustainable food systems. And some of those factors that have been proposed by the experts in the areas are physical and environmental factors that are coming together in perhaps not so good ways. Ecological factors, you heard a lot about that. Social, political, and economic factors, as well as genetic and biological factors. So the story is that these things are happening, they're changing, they're causing a lot of change. And if we look at our food systems, there really is an urgency to see what we can do to address them. Producing food, I was 15 years in the U.S. Department of Agriculture also, and I was the Chief Public Health Veterinarian for food safety. I haven't heard food safety talked about a lot, but it really started some very big scares. You see from these magazines, there are pathogens that come through the food system and into our system, which have some deadly impacts. One of the ones that was very early on in the late 1990s, was a family farm that had Salmonella typhimurium DT104, which is one of the first antimicrobial resistant organisms. The cattle were sick, the calves were dying, the dogs were sick, the people were sick, and it got into the meat supply. Well, every single government agency ended on that farm because they hadn't really figured out a way to how we're going to address this. And for sure, the social scientists were not there to talk about and to discuss with the farming communities how are they going to, what do they believe about this disease and how is it evolving. So it was quite an interesting lesson that there was not even collaboration among all the people that had to be involved in this. We've heard about climate change. It impacts the disease vectors and their hosts. And really, I want to stress again that this will have a greater impact and is having a greater impact on the poor socioeconomic populations. Huge water wars are evolving and are going to be really critical in the future to address, particularly for agriculture, aquaculture, and us providing the food that we need to feed the population growth in the world. So what I'd like to have here is as an example of a complex food system. I know you've seen some other slides of it. And this one's going to focus on the Shiga toxin-producing E. coli 0157. So you have some cattle, you could have elk, you could have caribou, you could have any kind of animal that's really involved in eating the grasses and being in the environment, but particularly cattle. They shed the E. coli 0157 in their feces and their salivary glands. It gets into the silage and the grain because we're producing on lands that may have effluent, as you heard about. There's manure and slurry issues, which we just discussed. So the humans, the domestic animals that are roaming the land, the wildlife that's roaming the land, and the ecosystems can be harboring and being impacted by the presence of this organism. Sometimes it kills the other species, but mostly cattle are very happy shedding it. And then it gets into the food supply, not only our meat, but it gets into the produce. You've probably seen some produce recalls recently. So everything can be impacted by the pathogens that can be present in our food supply. And then our food supply is shipped nationally and internationally, so these organisms can spread. So again, we have this huge potential convergence of things that are happening that lead us to worry about our food supply. And one quick story was that the way that a vaccine was developed in Canada, they wanted to provide a vaccine that you could give to the cows that would cause less E. coli shedding. So the researchers got together and they developed a vaccine. And then they told the producers, you have to get the cows out 3 times. Producers said, we're not getting our cows out 3 times. That's a lot of investment and time. And so what they didn't do is they didn't really work with the producers. They didn't work with the public health agencies to talk about from the very beginning, the very onset of figuring out what are we going to do if we are going to develop an E. coli vaccine. So my moral of the story is that it really has not been used because, in my perception, if we brought in those communities and those and the public health agencies from the very beginning to develop what we call a conceptual framework for that research project, it might have had a better outcome, or it might have led to, we really can't do this. And one of the things that the company did is they asked the Public Health Agency of Canada, would you pay for this vaccine? Because it's really a human vaccine, but it's being treated, but cows are being treated with it. This is kind of an innovative idea, but because we didn't have a conceptual framework from the very beginning on how we're going to address this, I think that it was setting itself up for some failure. So that's one of the reasons that I'm talking about. How can we build capacity to better solve these complex food system challenges? Okay, you with me? So first, we need to consider the deep-seated root causes of ill health and inequities. And this is what the social sciences bring to the table for us. I never really worked as a veterinarian, many with social sciences, and obviously that these developers of the E. coli vaccine didn't either. But they are absolutely critical in understanding the social, cultural, the psychological, the gender, economic, health policies, human, animal, and also our ecosystems and the way people value and for centuries have worked in partnerships with the ecosystem. So this really requires a socio-economic, preventive One Health approach. If we're going to make lasting changes in food systems, we need to really consider how do we do this in a socio-economic preventive way, and how do we create the leaders that can lead this type of work. So the One Health approach, this is the model that we used in Calgary for an article that we published in Social Science and Medicine. You need to look at the disciplines of the social sciences, veterinary medicine, human medicine, and of course the ecological sciences. But when you tease this apart, what disciplines are involved? Okay, you have veterinary medicine, animal and plant sciences, nutrition, human medicine, biomedical and bioinformatics, governance. You can't really proceed forward with change without appropriate governments and policy planning experts. Ethnobotany, that was mentioned earlier, communication sciences, economics, anthropology, geography and mapping, particularly medical geography, sociology, psychology, public and population health. When we need to take the One Health transdisciplinary approach, we need to be able to understand the disciplinary languages that all of these speak. We also need to understand how are we going to get them to work in a collaborative way and bring together conceptual frameworks, proposals that can lead to One Health solutions to our food systems. So we've talked about multidisciplinary, interdisciplinarity. Maybe it's not so clear what transdisciplinarity leaders are. Let's go through a little exercise here. Multidisciplinary, you got a bunch of fruit in a basket. Everybody has their disciplinary lens on, and they go around and they do their very important basic disciplinary research. Okay? Interdisciplinary, multidisciplinary, you build a few more meetings. It's kind of like a teamwork. You're on a team grant, and you've got the disciplines working together and talking to each other, but they're still holding very strongly to the disciplinary expertise. A transdisciplinary leader is the smoothie. They're surrounded by the hopefully interdisciplinary groups that have been cut up a bit and understand each other better. But this is what we're really looking at. How do we develop the transdisciplinary leaders that can be the glue that brings groups together, that keeps a project going, and yet can understand the languages, the cultures, not only of the other disciplines, but of the stakeholders and end users? That's a very special person. And I'm really excited when I see students at meetings like this and they're hearing about One Health. They're getting excited about this. They're getting excited about what you do here at FIPS. How do you develop new career pathways for them? Okay, so they need to have this intersectoral blending experience. It can be experiential, it can be disciplinary. Okay. This is what I call the One Health disciplinary, collaborative and interconnectedness that we need to develop our future leaders. So what's an example? I'm a protege of Dr. Jakob Zintag from the Swiss Tropical and Public Health Institute. Whoops, I got 2 minutes, okay. And this is where he's really brought in the socioeconomic, the cultural awareness. So you'll have very beginning. So this is the very beginning of a project. It's talking about rabies and anthrax vaccination in Chad. You bring in the decision makers of those communities first. You have your scientists there. You have community participants, right there involved in what do we want, what are our beliefs, what are our feelings about this. And then you have the transdisciplinary One Health practitioners. That can be the woman who is actually a medical anthropologist. It could be the gentleman there who might be a basic scientist, but they have had experience. And unfortunately, it often takes a whole lifetime of working in these professions to gain this experience. My beef is that we need to do it faster. We need a dramatic shift in academia. We need to encourage, support, and create opportunities for transdisciplinary training and research to complement the traditional disciplinary research approaches. And this would have the persons would be trained and educated in prevention and root causes of unsustainable food systems. Okay, how do we do this? Research and practitioners need to be trained in participatory and interactive processes, linking the natural and social sciences. We need transdisciplinary practitioners and that they are valued. They're often not valued in academia because they're considered generalists, but they should be valued as other disciplinarians, and they need to be involved from the beginning of a project, a research project, even a basic research project. And research-led universities are going to be especially important to do this. Dr. Zintag says that there's a new career pathway that would meld medical sciences, political, humanities, STEM, and communities, and we're going to call that the transdisciplinary blender. Recently, we know that funding agencies are starting to look at the fact that we need to fund transdisciplinary One Health approaches. And the National Science Foundation just has a call for proposals out for navigating the new Arctic, where the food supply primarily is caribou and from the ocean. So universities and academic people who've been trained to do this type of work will have an edge in getting this grant. So I believe that the funding agencies are starting to see the light, that we need to look at social systems as well as the basic. So what are the barriers? We've got challenges. Time. Okay. Long-term relationship building is really hard to do. It's easier to do something quick. Disciplinary language and cultures are so different. We have institutional silos in academia as well as other organizations, and we lack even shared reporting systems. We have budgetary strengths and unequalness in power, where the basic scientists often get a lot more money than the humanities and things, and so there's a power struggle in academia that needs to be overcome. And rewards are lacking. We don't reward often intercollaborative team grant or team type of work. And we have the lack of expertise in transdisciplinarity. Call to action, these are the basic things that need to happen in academia and other organizations. We need to focus on enabling environments with collaboration and co-location, really helps that. Develop a transdisciplinary curriculum, mentorship, team funding, and of course performance awards for doing this type of work and being that type of person. We need to create a culture of integrative research. Co-locating and clustering and joint professorships are all really great tools to use. One thing that we did at the University of Calgary that's just happened is the whole university created a One Health mandate for research. That really helps when you have an overarching mandate within the organization. I'll skip this. I have some examples of the competencies needed to do this type of work. In food systems, these are some of the players that need to be involved. I do have a slide here of a curriculum that was developed by the Canadian Food Inspection Agency to bring One Health actually into their government regulatory officials training. And I have one book here that if you haven't seen this book or applied any effort to get it, it should be in your library. And it's The Theory and Practice of Integrated Health Approaches. Dr. Zintog and others have put together a tremendous amount of case studies, focuses on the EcoHealth, One Health, developing One Health transdisciplinary practitioners. And I've took you through the food journey, and I've got a question for you. What's in our future? I've heard that being asked, and I'm going to say you.